Hi, my name is Cameron Harper, and my research topic/question is how does culture affect humans' health and wellness, both mentally and physically? Throughout my research, I explored many different things. I explored religion, ethics, beliefs, and different health issues among different cultures, and these cultures' perceptions of health. Some points that I tried to focus on include what patients and health providers believe about the causes of disease, what types of health promotion activities are practiced in poorer countries, and how different cultures perceive certain treatment options for illnesses. In my research, I looked at many different cases from different cultures. I'm going to share a few with you. The first one is about how cultural factors influence obesity in Tanzania, Africa. This country usually has starvation issues, as it is one of the poorest countries in Africa. So, why is obesity becoming an issue? One reason would be that this area is exposed to a new sedentary lifestyle that they are not used to, according to Isabel Rosen. Also, the healthcare system is not large enough to handle the increasing rate of patients that are coming in. Another example comes from Nepal. The reproductive health of women and their life expectancy after giving birth is very poor and low. One reason of this is early marriage. The bodies of these women that are giving birth so young are not ready for what they are about to go through. Some of these girls are getting married at the age of 11, 12, or 13, after which they must immediately begin bearing children. This takes away important time for a girl to develop emotionally, physically, and psychologically. Also, because these young girls are forced into early sexual activity, there is a very high rate of HIV. There are also cultural practices that affect health. One of them is female genital mutilation in Africa. This causes health complications for girls and women around sexual health and pregnancy. Also, in extremely poor countries, children become resources. They are traded for money, food, or other needed materials. And one can imagine that through this trading process, their health is not the main concern. Also, in the US and other countries, people use alternative or traditional health practices. According to the American Academy of Pediatrics, some cultures use the concept folk illness. Folk illness is a combination of psychiatric and somatic symptoms that are considered to be a recognizable disease within some cultures. Sometimes the treatments of this folk illness include traces of ink. Therefore, actually, it poisons the person that they are trying to cure. So, as you can see, health and culture really do go hand in hand. To look at health, one must also look at different cultures to see the different ways that these cultures are affected by its habitants' health and the way that these different cultures perceive health as a whole. So many different people are influenced by their culture's perception on health, so it really affects everyone in this entire world population. I picked this research topic because I think it is something that everyone should know a little bit about. I think it is important to demonstrate awareness of cultural differences since there are so many around this entire world. There are so many different cultural practices and beliefs when it comes to health, especially whether they're good or bad. And I believe that this is something that is beneficial to learn in this anthropology class and through my essay. I personally have learned so much through this topic of research, and I can't wait for you to read my essay so I can inform you of more of my research. Thank you so much.